Hello everyone, welcome back to our channel. I hope you're all doing well. I hope the little ones are doing extremely well. In this video, I'm going to share with you some of the problems or issues or common symptoms, however you want to call it, of premature babies, usually in all the premature babies when they are born. So now, without further ado, let's get straight into the video. I'm going to tell you the two important problems at the end of this video to make sure you watch this video until the end. So starting with our first one, usually as you all know that premature babies usually look very smaller than the term babies who are of the same age. The second one is the premature babies have usually the head larger. Their head is larger and their body is smaller comparatively in the relative proportions. Usually for term babies, the body and the head is very relative. It looks proportionate. I mean, it looks good in a natural way, to speak in common language. But for premature babies, the body is smaller and the head is larger. Premature babies have a unique style of having sharp features. They have sharp nose, sharp fingers, and they have sharp everything. They don't have these rounded, cute kind of things. Of course, they look cute, but what I mean to say is they have sharp features because there are no fat cells in the body. So that's the reason they look very skinny, they look very small, they look very tiny, and sometimes they look like having wrinkles all over their bodies. But that's totally fine because eventually when they gain weight, they have their fat cells and then they start looking a bit rounded, chubby, and all the features will start looking cuter and cuter as they grow each day. Of course, they look cute every day, but I just want to tell you in the terms of having the rounded features. If you are a parent of a preterm baby and you're looking for more tips on how to take care of your premature baby at home, then I highly recommend you get this book. This is the book that I've written with all my experience and highly practical tips from doctors. So in this video, I have written about weight gain tips, feeding tips, sleeping patterns, signs of emergency, vaccinations, milestones, kangaroo mother care, and many other tips. And I've also written tips for you mamas as well. So I highly recommend you get this book. And if you also want to track weight gain, feeding, milestones, vaccinations, and many other things, doctor's appointments, and things to discuss with doctors in your next appointments, and tons of other things all at one place, then I highly recommend you get this weight gain feeding tracker. This is extremely useful for all the parents of premature babies. You can get this book on Amazon, Flipkart, and Notion Press. So the next feature is having fine hair all over their face, all over their body. Many of the parents have shown me the concern in the comment section down below that how to remove the hair or what can I do, shall I scrub it, or many things. Don't do anything. That fine hair will eventually, they will just go away. You don't have to do anything separately. Actually, the fine hair that is present all over the body for any baby is to protect themselves, to keep themselves warm in the womb. And as the baby is growing, the baby will shed the fine hair that is present on their body inside the womb itself. So when the babies are born, they are born with only few hair at the end of the, at the end of 40 weeks or something. But our babies are still at 30 weeks or 32 weeks. So they still do have that fine hair on their body, and that's nothing wrong. Eventually it will go away, don't worry. Olive, when she was born, she has so much of hair all over her face, all over her body. Eventually as she was growing and getting older and older, it just went off by itself. You don't have to do anything. The next one is having low body temperature. This is right after their birth, so you don't have to worry about. That's the reason doctors recommend us to use yellow light or put them in warm temperatures, because they feel cold and they're skinny. They don't have that fat cells or muscles build up to protect themselves from extreme cold outside the womb. So we need to make them feel warm by having adequate layers and also having a yellow light in the room. Now we have reached to the two main features that are problematic a bit, which are scary to listen to, but still they have, and the doctors, the healthcare professionals manage that, and by the grace of God all the babies will be fine. So the first dangerous tip I can say is that they don't know to breathe by themselves. They can't breathe by themselves, so you need external oxygen support for them to breathe in and breathe out for a particular time. So that will be analyzed by your doctor or your pediatrician, like how many days your baby needs support. But eventually, as the baby is growing over the period of time, they will learn how to breathe in and breathe out. So the first dangerous problem that premature babies have is they don't know to breathe by themselves. So what happens is sometimes they even stop breathing for a couple of seconds, like 5 seconds or 10 seconds, and that's dangerous. That's called a sleep apnea. Apnea is when they stop breathing. So that is difficult. That's the reason we need to watch the baby carefully. And in Olive's case, doctor has given us a medicine that was used in NICU, and the doctor recommended us to use it even after NICU. I think weekly once there was a medicine. I can't tell you the name of the medicine because that has to be recommended by the doctor, but it's related to sleep apnea because Olive had apnea. I've just realized that I lost a part of my footage regarding the second tip, so here is the second tip. The second main issue that premature babies face is having immature or underdeveloped lower jaw. That's the reason it's difficult for them to suckle to the feeding bottle. I clearly remember when I gave a feeding bottle to Olive when she was quite young. I remember I used Philips Avent bottle. It was literally choking. She wasn't able to suck from the feeding bottle. So that's the reason we use a spoon or a traditional cup, that is the normal way of feeding a baby. And however, when I realized that it was choking her, I then switched to use a 60 ml feeding bottle. As the jaws are very weak, the baby finds it difficult to swallow or even suck. That's the reason they really drink milk very slowly. So we as parents need to be patient in that area. That's the reason I always recommend the mothers of premature babies to get smaller size nipples using 60 ml bottles. So with that said and done, I hope you all understood this common symptoms and signs of premature babies soon after their birth. Don't worry, all this will go away once the baby starts to grow and gain weight. Eventually that happens in the 3rd month or 4th month and 5th month. By 7th month they will be all chubby and bright and active and all. So don't worry. Enjoy this time. Enjoy the kangaroo mother care, because these days will never come back. So take care of yourselves and take care of your little ones. If you do think this video has added value to your information on premature baby care, please don't forget to hit the like button and leave your comments down below. I'll see you all in the next video. Bye bye.